Okay, so today we're working on a patient who's 32 years old and tooth number 19 has a vertical fracture right through the furcation. We confirmed that with a CBCT. So today what we're going to do is we're going to extract the tooth, and since after an extraction we usually get about 20% bone loss, we're going to place some allograft material bone, cadaver bone, and our bone is Puros cortical cancellous particulate. I usually start with 0.5 cc's. I have an extra 1 cc in case I need it, but typically this is usually 0.5 cc's for an extraction site is more than enough. And then the membrane that we use here is a copious extend membrane, both by Zimmer Biomet. So you're going to see this here. This has a reference number and a lot number. We want to make sure we put that in the chart, both for the membrane. The membrane's bovine typically, and the cadaver bone here also has a reference number and lot number that needs to be put in the chart. You can see what the membrane looks like right here. I don't use the whole thing. I only cut what I need and put back in the package. Now I want to look at something clinically real quick for the patient. You can see here in his mouth that he has an abscess right on the buccal. You can see how big that abscess is. And that's pretty indicative of a fracture when the abscess on the buccal is more towards the crown margin cervical furcation area. Typically, if it was an abscess that was periapical related, you would see it more in the vestibular area and it would swell more down into the lower ridge. Now, we're going to use a dry shield when we do extractions because it's going to come out in pieces. And I'm going to try to section the tooth in 2 different pieces just so that I can maintain this interradicular bone right in this area here.